from the pubic symphysis to the ischial tuberosities, and then back to the coccyx. That's the perineum, and then we divided that into a urogenital triangle and an anal triangle. So to do that, we basically just draw a sagittal plane through here connecting the ischial tuberosities. Then anteriorly, we have the urogenital triangle. Posteriorly, we have the anal triangle. So our attention will be at the urogenital triangle here. So the parts that we see here are, of course, the mons pubis, this just mound of basically skin and adipose tissue in front of the body of the pubic bone. But then that's continuous with the labia or lips, labia major or labia majora. So, okay, so that's pretty straightforward. They connect anteriorly at an anterior commissure and posteriorly at a posterior commissure. And then, is that, I hear rustling, I don't know if that, yes?
In the diagram, it's labeled as the labium majus. Is that the same thing as the labium?
Yes, yeah, labium major, labium majus. I think we typically say majora, labia majora, labia minora.
Okay.
But, so either of those terms. And anytime you use the language that's on the diagram, there would be no argument with that anyway, so, yeah. So, then if we go medial to the labia majora, we see the labia minora, and they also connect, the two labia, left and right, connect anteriorly and posteriorly. Posteriorly here, it's referred to as the frenulum of the labia minora. So, but anteriorly, if we follow each one of these skin folds, so this actually is skin, it will divide into two lamina, a lateral lamina and a medial lamina. And the lateral lamina is going to continue anteriorly and form a hood or a prepuce that covers over the glands of the clitoris, which we haven't talked about yet, but we'll get to that. So that's the prepuce. And then the medial fold is going to go medially and connect with the one from the other side to form this frenulum here. Frenulum of the clitoris. That is just on the posterior aspect of the glands of the clitoris. So the other thing I'll just point out, we do see the erectile body here, the clitoris, so we see the glands of it on the external aspect of this region. And the region in general often would be referred to as a vulva. Pudenda is another aspect, another term that's used for the external genitalia. But you can see the glands of the clitoris, again, covered by skin, but we're going to see that it has a body and a crura that attaches it to the ischiopubic ramus. We'll see that when we begin to go into the pelvis and look at the dissected, or look at the dissected urogenital triangle. So the other terms that are important here is this space that is outlined by the labia minora. Right here, this would be referred to as the vestibule of the vagina. So vestibule is just like an entrance way, so the vestibule of the vagina. And then we've dealt with this before when we were doing the urinary system, and we talked about the female urinary system. We mentioned the external urethral orifice right here. So this is similar but different from the male. So of course we learned that the male reproductive and urinary tracts are shared for the distal portion of that course. In the female, that's not the case. So in the vestibule of the vagina, there is the opening of the vagina, and you can it's labeled here, vaginal orifice. It's most posterior in this space, and then just anterior, as we talked about when we did the urinary system, we see the external urethral orifice, but that orifice is only the opening for the urinary tract, it doesn't have anything to do with the reproductive tract. And then anterior to the external urethral orifice is the glands of the clitoris. So I think with that, what we can do then is begin to go into the pelvic cavity and look at the rest of the organs of the female reproductive system. So in the sagittal section, we can get an overview of what we're going to be looking at. So here would be the labia majora and minora right here, or majus and minora, as pointed out. And then, so this space between the labia, the left and right labia minora would be the vestibule. And we see the urethra, of course, that we're familiar with, but also the opening of the vaginal canal right here. And the vagina is going to protrude into the pelvic cavity and then be continuous with the uterus. Okay, now what we don't see very well here is the connection between the uterus and this tube right here. This is the uterine duct. Sometimes it's called an oviduct, sometimes it's called a fallopian tube. Any of those terms are fine. That's going to run laterally. Of course, there will be two of these, one on each side. They'll run laterally and a little bit posteriorly and take up a relationship with this white structure right here, which is the ovary, the gonad. And like the testis, it began its embryological life up in the abdominal cavity, and then it migrated interiorly along the posterior abdominal wall down into the pelvis. So just like with the testis, it was dragging structures along with it, so it's bringing its blood supply with it. So we're going to expect to see the ovarian artery coming from the aorta, not from the internal iliac artery, like most of these other organs down here would be getting their supply from. And then, so the other thing I want to bring your attention to here in this diagram, since it's, you have to use less imagination in some of the other pictures I have, but we know what the parietal peritoneum is. We've been talking about that for a while when we talked about the GI tract and the abdominal cavity. So you know that the abdominal wall here has as its innermost layer the parietal peritoneum, right? So now the thing that we want to watch here is as the parietal peritoneum comes down the anterior abdominal wall, it reflects over these pelvic organs. So here we see it making a roof over the urinary bladder. We've talked about that. So we talked about these pelvic organs as being sub-peritoneal, not retro or behind it, but below it. So these pelvic organs are subperitoneal. Now we see that there's a very sharp reflection in the peritoneum as it goes to the fundus of the urinary bladder and then reflects over what we refer to as the uterus right here. And then when it gets to the peritoneum gets to the posterior aspect of the uterus, it reflects again and goes over the anterior surface of the rectum right here in the midline, and then begins to go back up the posterior abdominal wall where we saw it gave rise, it was connected to the mesentery proper, the sigmoid mesocolon, structures like that. These spaces, especially this space back here, it gets its own name. It's called the pouch of Douglas, and it's quite prominent in the practice of obstetrics just because of its close relationship. It's also its close relationship to the vaginal canal, but also it's the lowest, one of the lowest spots in the peritoneal cavity. So if a person, say, is bedridden and they're producing ascites fluid for some reason, have an infection in the peritoneal cavity, fluid is going to be collecting in this space, in this, I mentioned the pouch of Douglas. It's also referred to as the recto, so this is the rectum, the recto-uterine space. That's the recto-uterine space right there. And then, of course, if we go back to the perineum or urogenital triangle of the perineum, we see the pubic bone right here. This would be at the location of the pubic symphysis, and below it, this diagram shows this purple structure. That would be the clitoris. So we were down here, we would just see the very tip of it, the inferior-most end of it. That would be the glans covered by skin. But then, and of course, it's an erectile body, and it's going to be attached to the ischiopubic ramus, as we'll see. So I guess I see some other words here that I haven't mentioned, like greater vestibular glands, so they're just, they're not erectile tissue or anything like that. They're just, secretory glands lubricating, this area, and same with, the lesser vestibular glands. They're tiny, histological structures. The greater vestibular glands you can kind of see in a dissection, but not very well. I mentioned the clitoris. It's erectile tissue. There's also another structure called the bulb of the vestibule. It is beneath the skin of the labia minora, and we'll see where that is, but you have to dissect to see those. So again, that's erectile tissue. And then I mentioned here the round ligament. So we're getting a little ahead of the game here, but the round ligament is a ligament that is attached interiorly to the uterus, but it's going to extend from the uterus through, in fact, you see it shadowed in right here. It's going to go through the deep inguinal ring of the abdominal wall, go through the inguinal canal, and then it'll exit the superficial inguinal ring, and it will insert itself into the subcutaneous tissue of the labia majora. And it's not all that important a structure, except that in the practice of obstetrics, a lot of women who are at the beginning stages of a pregnancy and the uterus is beginning to swell, their abdomen is beginning to protrude, they get this, they get pain pulling in their urogenital triangle in the labia majora, and it becomes usually often of great concern, but all it is the abdominal wall is expanding faster than the round ligament can stretch, and so until the round ligament gets longer, they can get this painful sensation. Yes? It goes into the labia majora, yeah, into the subcutaneous tissue that forms the labia majora. All right. So let's go in now and into the pelvic cavity and look at the structures here that we've been talking about. So this is an overview. We'll look at this diagram first. It's the most simplified, I guess, compared to this. So this would be the vestibule of the vagina down here inferiorly. Here's the opening into the vaginal canal. And as you go superiorly here, you see that the wall of the vagina becomes continuous with the inferior end of the uterus, this thick region right here. And we'll talk about the parts of that. The uterus then, of course, has this thick muscular wall and a mucosa lining the uterine lumen. And at the superior end, on the left and right side, at the superolateral margin, I guess you could say, the lumen of the uterus is actually continuous with the lumen of these ducts, the uterine tubes or fallopian tubes, oviducts. So you can see these thin tubes that expand laterally and then have this opening. They actually have an opening that's not really connected to anything. It just is open to the peritoneal cavity. But it does have a pretty close relationship to the gonad, to the ovary, which you see right here. The ovary, of course, is the site where oocytes are mature, finish their maturation actually. Yes?
Sorry, back to the round ligament thing. Is this
Okay.
round ligament the same as the round ligament in the liver? Or is this something?
Good question. So we've used the term before, round ligament, in association with the liver, where technically that was called the round ligament of the liver, and that is a remnant from the umbilical vein. This is the round ligament of the uterus.
Okay, so there's
Two different structures, two completely different structures.
Okay, thank you.
Yeah. Mm-hmm. Okay. So obviously then here well, not obviously, but in fact the distal end of this oviduct is a little bit modal, and it does move around, and at a particular time of the menstrual cycle, when ovulation occurs, this opening of the oviduct is going to be positioned relative to the ovary so that a released ova, which just bursts out of the ovary, there's no duct or anything like that, it's following, it just bursts into the peritoneal cavity and then is taken in by this distal end of the oviduct, and it begins to be transported down this tube towards the uterus. Okay, so that's an overview then of what's going on here with the female reproductive tract. There's something else I want to talk about in relation to this figure, is where we have the oviducts, the ovary, the uterus, and the vagina has been disconnected here, so we're not seeing that, but look at this sheet of material right here. It's removed on this side, but it's present here, it's not included in this diagram at all. This is actually that peritoneum that we were talking about, that we saw coming down the anterior abdominal wall, and then it just folds over the pelvic organs, forms a roof over the bladder, forms a outer surface of most of the uterus, and then it extends along the oviduct. And it also then has another part that you really can't see here. This portion of it just forms a little hinge-like structure that then encases the ovary. Okay, so that's maybe easy enough to envision. The geometry of it is a little bit complicated. This peritoneum that is associated with the uterus, with the oviduct, and with the ovary is referred to as the broad ligament. So the broad ligament is just a certain part of the peritoneum that is covering these reproductive organs. And then we talk about 3 different regions of the broad ligament. The first region, the biggest region, is this area right here along the body of the uterus. This is called the mesometrium. So remember when we were talking about the GI tract, we had the colon, the transverse colon, that was attached to the posterior abdominal wall by a mesocolon. The sigmoid colon was attached to the posterior abdominal wall by a sigmoid mesocolon. So this is kind of the same way that terminology works. So we have a mesometrium. And then the portion here of the peritoneum that's covering the uterine tube is referred to as not the mesouterine tube, it couldn't be that easy, it has to be the mesosalpinx. And so salpinx, somebody should Google salpinx, but the word I think means like trumpet or horn or something like that. So I look that up regularly and then I always forget. So trumpet? So the idea is this tube expands into this thing that looks like the end of a trumpet or tuba or trombone. I guess they chose trumpet, but anyway, so mesosalpinx. Then the mesometrium and the mesosalpinx, you can imagine them meeting just anterior to the ovary here. They form another double-walled mesentery that then wraps around the ovary. And that one gets a better name. It's just called mesovarium. So that's the broad ligament. And again, people practicing obstetrics are really tuned into this. That it goes way beyond just anatomy, but it's really kind of an important player in obstetrics. So that's the broad ligament and its 3 parts. There are a few other ligaments here, maybe too many. So if we look at this superior lateral region of the body of the uterus right here, we saw the uterine tube was attached there, but just anterior to this, we see this cord coming off. That's the round ligament. That's the round ligament of the ovary. So we haven't really talked up too much about this, but where's it going? Well, it's going anteriorly now, and it's going to reach the deep ring of the inguinal canal, go through the inguinal canal, and then into the subcutaneous tissue beneath the labia majora.
Dr. Anstrom?
Yeah.
Where exactly is the mesovarium in that
So
picture?
well, first of all, it's covering this, the ovary right here.
Okay.
So this is, it's not obvious, but in this diagram right here, this person would be looking away. So this is a posterior view. I know that because the ovaries are posterior to the uterine tubes where they come off here, and the round ligament is going anteriorly. But if we grab this ovary, we would see that it's tethered by this short mesentery that connects it to the mesosalpinx and the mesometrium.
Okay.
So, okay. Yeah, as I said before, the geometry of this is a little bit challenging, so. Okay, so the other structures that we're looking here, I mentioned the round ligament. The other thing is this so-called suspensory ligament of the ovary, and I think we can make sense of that. So I mentioned before that the ovaries, embryologically, they began their life up in the abdominal wall, up in the abdomen. And then they migrated from the abdomen down into the pelvis, and as they did that, they brought their arterial and venous supply along with them. And when they got to the pelvis, they went over the pelvic brim down into the true pelvis, again, bringing these vessels with them. Those vessels get wrapped by their own layer of peritoneum and connective tissue, so it forms this like cord carrying the ovarian arteries and veins down into the pelvis to the ovary. Those vessels, along with the associated connective tissue and peritoneal covering, that they create the suspensory ligament of the ovary. So we're just getting, we see it here where it's intact, so it would be coming from the abdomen down into the pelvis and meeting up with the ovary. Here, on this side, it's been dissected a little bit, so the